So we're back, right? And as you know, I'm Dr. Shelley of HETV, and we've had some fun. We gave you a quiz, a chance to win half off of a 3-day NGN NCLEX review here in Cleveland, Ohio. As you may or may not know, that quiz expires in the next 48 hours. So, you better get on it if you want to win. Also, included in winning that whole half off of NGN and NCLEX review in Cleveland, Ohio. If you can't come to Cleveland, Ohio, I get it. Maybe you just need to purchase the pink packets, which is basically like coming to Cleveland, Ohio. Because remember, it's the Oh My God, it's the management of care, it is the infectious diseases, and reduction of risk, which is your procedures. So far that's 4. The 5th one is pharmacology. And of course, 2024 medication categories and psych meds. And last but not least, number 8 is the EKGs. But let me just make sure you know something. Remember, this is the latest as of, what is it? I don't know if you can see it. June? Let's see if you can see that. Where is it? Okay, yeah. It's the latest, y'all. I just updated this bad boy. So you get the June 2024 update of the Oh My God packet. And when you pass this quiz, you get all of these 8 packets for only $50. Yeah, I know. It won't last forever. So I'll tell you what, July 4th, yeah, you have till July 4th to get in on the quiz. And we will post the answers to the quiz after the 4th, of course. Don't be so impatient. And then we will announce the winners afterwards. So I'm looking forward to hooking a sister and a brother up. Now, we are here to talk about the NGN NCLEX and how to help you pass it. This particular video is going over that quiz that you took, the answers that go with the quiz, and the rationale from page 6 to help you on the quiz, and understanding everything that I'm teaching and why it makes sense when you take your test. So let's get started, shall we? Okay, so let's not forget, we are here going through your study guide for NCLEX called the Oh My God Packet Quickie, because that's what this is. It's a quick reference, it's got select alls that apply, it's got maternity pediatric quickies, it's got diets and cultures and positions and everything. So if you look at the Oh My God Packet Quickie, page 6, this is part 2 of who you should not see first. So here's what I'm talking about when you go to this page. It's really clear. You're in the Oh My God package, you go to page 6, you look at it, the title says NCLEX Quickie. If you go down just a little bit, it's all about who do you not see first, right? So who the hell should I not see first? The first part, which is a video we did last week, was who should I see first, okay? So now, that being said, let's talk about and rationalize how we came up with our quiz answers, okay? And happy July 4th, or day after, because that's when this video will be posted. Here we go. When you look at page 6 of the Oh My God packet, this quickie that we give you, there are certain classifications of patients on the test. You just do not want to make them your priority. Let's look at it. Discharges is one. If a patient is being discharged, as much as they may get mad at you for not hurrying up and discharging them, they're never your priority because they're not sick. They're not in need of a medication. They're not in pain. They're not short of breath. They're not you know, part of the routine patients on the floor that are going to be there tomorrow and need dialysis today and going for a CAT scan tomorrow and whatever else. So they're discharged. None of that applies. They're actually better than you are today. Now, I want to bring your attention to an example of this. How many of you remember going to the emergency room and you thought you had something serious going on, or you took your baby and you thought your baby was really sick? And there you sat and you finally got seen, which was a little bit of a wait just for that. And then when you got seen and everybody said, okay, this is what we're going to do. We're going to call in a prescription for this. We're going to go ahead and have you do this. We're going to have you follow up with so-and-so. And so you guys can go home now and, you know, whatever. And so the nurse will be in to discharge you. Remember that only an RN can discharge, not an LPN. That RN that needs to discharge you, which is legally the person you need to see before you leave, that RN who needs to discharge you just got a 4-year-old asthma patient in retracting and can't breathe, having a full-blown acute asthma attack. Oh, and by the way, a 65-year-old just rolled up with chest pain and a history of an MI. And then you have the lady who was at church, who was brought in by squad car because she can't move her left side and has all the signs and symptoms consistent with the stroke. And oh, by the way, there's the homeless patient who has a really high fever and is on antipsychotics and looks like they might be going into neuroleptic malignant syndrome. Oh my God, your discharge? Fuck you. I don't care. I will get there when I get there, and until then, screw you. Now, that's why people very often leave AMA. We all know this, okay? But that's just reality. That is our reality in America. That's how it works, okay? So discharges are not your priority. Let's move on. Teaching. Teaching is always important, but it's just not your highest priority. And there is one exception to that rule. That's the patient who needs pre-op teaching, because pre-op teaching is literally time sensitive because the OR must run on time. The surgeon is there, anesthesia is ready. What do you mean you haven't done the discharge or the pre-op teaching yet? You better get in there and get to talking, because this patient needs to know how to cough and deep breathe. They need to know about that incentive spirometer. They need to know they're going to have this, you know, whatever. You got to get in there and do your pre-op teaching. All right. Procedures, tests, and labs. Procedures, tests, and labs are all together. Here's the deal. If your patient was ordered a procedure, then of course that procedure, test, or lab, that means that they were already seen by a provider, because who ordered the procedure, test, or lab? Let me give you an example. Here it says that the patient is complaining of severe left calf pain and they're scheduled for venous Doppler ultrasound. If it did not say the patient is complaining of severe left calf pain and they were scheduled for whatever, if it just said the patient is complaining of severe left calf pain, they became a very high priority, because we know that could be a DVT. But once they said the patient complains of severe left calf pain and is scheduled for a venous Doppler ultrasound, they're not that high on the priority list compared to things that might be really, really serious. So they can take a little back step, because literally somebody must have seen them and anticipates that this could be a DVT because they ordered the appropriate test. That's critical. That is critical. So labs, tests, procedures, not as high a priority. Okay. Here's another one. Patients crying or upset or even angry, as long as they're not violent or suicidal, they are going to be at the bottom of the totem pole. That's why the angry patient waiting on the discharge is way at the bottom. And the poor, precious patient that just found out she has cancer is way at the bottom. Okay. The next one is a big one for you. I hope you got your pen and you're taking notes. and that is pain is not a priority either, unless the pain interferes with breathing. And examples of pain that interferes with breathing is pancreatitis, a coronary artery bypass graft, or some other thoracic surgery. Let me explain. If I have pancreatitis, I don't know if you could see it, I have epigastric pain, right here. Sometimes your patient says my chest hurts. Sometimes they say my stomach hurts. But either way you go, epigastric pain is right here. If it hurts right here, do I want to do this? And because it hurts right here in a very severe way, like on a scale of 1 to 10, it's 200 with pancreatitis. In fact, let me tell you this, pancreatitis is one of the most painful conditions on earth, except for there's a close tie, and that is sickle cell crisis. So research has shown us that pancreatitis and sickle cell crisis are the most painful conditions on earth. But sickle cell crisis doesn't interfere with the act of breathing. Pancreatitis does, so it's a high priority. In fact, one of the first nursing actions with pancreatitis is treat the pain first and give IV meds. But if they don't have an IV, then your first nursing action is start the IV. Okay? So unless the pain interferes with breathing. So thoracic cavity, that's fancy for my entire chest cavity. If I have surgery anywhere in here, I'm probably not going to want to take a deep breath. It's going to hurt when I try. What happens in a CABG or a coronary artery bypass graft surgery? Oh, they just split your chest and crack your ribs and break your sternum and then put you back together again after they took your heart and put it on a bypass machine. Crazy. That person's going to have a hard time breathing. Their pain management is your highest priority in that situation, but otherwise pain, not really a priority. Okay? The next category of who you do not see first, you don't, is the section of diagnoses that I put here. Renal patients, nah, because here's the deal. Kidney disease is not going to kill you today. Remember that question we had to ask ourselves? What's going to kill you today? What could possibly do you in today? What could make you meet your maker in heaven today? What could kill you today is not renal failure. No. Renal disease, UTIs are not going to kill you today. Pyelonephritis is not going to kill you today. It just isn't. Sorry. How about STDs? Now, come on. Your crotch rot might embarrass you. Your crotch rot might be funky and stank. Your crotch rot is as disgusting as maybe it could get. And maybe your crotch rot is a bunch of bumps, sores, and lesions, and oh, God. And maybe, just maybe, your STD is really serious and it's HIV. It doesn't matter. These are not priority patients. They will never be priority patients. They just won't. Next is, this one you mess up on the test a lot. Fractures without evidence of a compartment syndrome. Here's what I mean. There's a hip fracture on your test and you think, oh my God, fat embolism. Oh my God, compartment syndrome. Oh my God. Stop it. Just stop. Without evidence of any of those things, don't go seeing these patients first. Please stop it. You need a hip fracture that says the patient's cast is too tight. Or not cast, but their traction is too tight. You need a patient who broke their humerus and has a cast on and says, I can't move my fingers or my fingers are tingling. That's what you need. Not a patient with a fractured arm who says it hurts really bad. No, that's not evidence of compartment syndrome. Generally speaking, evidence of compartment syndrome is any complaint about a cast or traction. Okay. Fat embolism, same thing. Don't do it. Don't see a fracture first unless you have evidence of compartment syndrome or fat embolism. Here's one that gets you. Pregnant women with swollen feet. Okay, let me tell you something. Everybody pregnant got swollen feet and ankles. It's called cankles. Now, so you do not see pregnant women who have swelling in their feet or their legs first. They must have swelling in their hands and swelling in their face for you to know that's a medical emergency, and she could have preeclampsia. Next, babies over 6 months of age with a fever. You don't need to see them first. High fevers in babies over 6 months of age is very common without extra stuff added to it. No, this is not the one you see first. Try to ignore the word severe, because you guys get kind of wrapped up into severe, unless the person with the severe attached to them on your test has the same diagnosis as page 7 of your Oh My God packet. I hope that helps. I really, really do, because if you look here, that would have helped you quite a bit if you knew not to see crying or angry people first. It probably would have helped. So deuces, I hope that helps, and I hope you win something, because we have so much to give away. Bye-bye.